Welcome to Indian Anatomist. Individuals who wants to perceive career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is General Anatomy 4. The topic is General Anatomy of Skeletal System. What is skeletal system? Skeletal system serves as a framework for the rest of the body to rest on. Now, what are benefits of skeletal system? They provide shape and structural support, production of blood cells, organ protection, and mineral storage. The skeleton is made up of bones and other connective tissues like cartilage, tendons, and ligaments. A different name for it is the musculoskeletal system. Skeletal tissue is derived from mesoderm. This is a part of the current lecture series on general anatomy. First, I will now explain how bones are classified. In general, the bones are classified: 1. According to their position or region. 2. According to size and shape. 3. According to their structure, and 4. According to development. Number 1, the bone according to their position are categorized into two main groups, namely, the axial and appendicular skeleton. Number 2, the bones are categorized into 7 types based on their size and shape. They are long bone, miniature of long bone, short bone, flat bone, irregular bone, pneumatic bone, and sesamoid bone. Number 3, the bones are developmentally classified into membranous, cartilaginous, and membrano-cartilaginous bones. Finally, number 4, classified according to their structure, is compact and spongy bones. Axial skeleton forms the axis of body, or the bones located in the midline. Out of 206 bones in adult human, the axial skeleton comprises 87 or 80 bones. That includes 22 skull bones, 6 ear ossicles, 1 hyoid bone, 1 sternum, 24 ribs, and 33 vertebrae. The vertebrae are further categorized into 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae. The 5 sacral and 4 coccygeal vertebrae undergo fusion, resulting in the formation of a single sacral and coccyx vertebra, respectively. Now, appendicular skeleton. Appendicular skeleton includes 126 bones, consists of the bones of the upper limbs, responsible for the manipulation and grasping of things, and bones of lower limbs, enable mobility. In addition, it also comprises the pectoral or shoulder girdle, that contains paired clavicle and scapula, and pelvic girdle comprises paired hip bones, which serve to connect the upper and lower limbs to the body correspondingly. The upper limb consists of a bilateral arrangement of skeletal elements, which comprise 2 clavicles, 2 scapulae, a pair of humeri, as well as the radius, ulna, 16 carpals, 10 metacarpals, and 28 phalanges. The lower limb comprises 2 hip bones, a pair of femurs, tibia and fibula, patella, 14 tarsals, 10 metatarsals, and 28 phalanges. Next, I'm going to talk about how to classify bones based on their size and shape. Dear students, you will get a lot of test questions from this classification. I previously posted a clinical, multiple choice question video on bone size and structure. Refer to the description box for the link. What are long bones? Long bones are cylindrical and longer than the other types of bones. These kinds of bones are found in the limbs or extremities. These bones act like levers and help us to move by working with different muscles. Examples for long bones are humerus, radius, ulna, femur, tibia, and fibula. Because each of the long bones are solid and substantial, the human body is able to move around without restriction. The following components, that make up every long bone in the body, are epiphysis, diaphysis, metaphysis and epiphyseal plate. The human body's long bones are all arranged in a vertical orientation, with the exception of the clavicle, also known as the collar bone, which is laid out in a horizontal orientation. Now, what is epiphysis? The epiphysis, also known as ends, it is always 2 in number, for each long bones, that is, upper or proximal end, and lower or distal end. Each epiphysis ossifies from more than 1 secondary ossification centers. The diaphysis, also known as shaft of a long bone. It ossifies from single primary ossification center, except clavicle, which has 2 primary ossification centers for its shaft. The shaft consists of outer compact bone with central medullary cavity or canal that is filled with bone marrow. In adults, red bone marrow is replaced by the yellow bone marrow. Now, what is metaphysis? The extreme ends of diaphysis, or shaft, are called metaphysis, which meets at the epiphysis. It is the zone of active growth. What is epiphyseal plate? The epiphyseal plate is present in children and adolescents, before the ossification of long bone. In adults, growth ceases, and the plate is replaced by an epiphyseal line. The epiphyseal plate, or growth plate, or simply, physis, is a hyaline cartilage plate that joins the metaphyses and epiphyses of a long bone. This is the site where the new bone remodeling occurs. Girls' epiphysis, epiphyseal plate, and metaphysis usually fuse at 12 to 14 years old, and boys at 14 to 17 years old. The picture, displaying the X-radiograph of knee joint of a young children, showing a gap present between the metaphysis and epiphysis. This gap is occupied by the epiphyseal plate, made of hyaline cartilage, which is radiotranslucent, so appears black in color. Can an X-ray confuse a growth plate for a fracture? An ossified bone growth plate in a young children can imitate a fracture. Towards left side, X-radiograph image, showing the unossified shaft, with separate metaphysis and epiphysis. Black color gap representing the epiphyseal plate. At the same time on right side, in adults, the metaphysis and epiphysis are completely fused, and the epiphyseal plate is replaced by epiphyseal line, remnant of growth plate. At this point, you all know about the parts of the long bones. Long bones are important for humans because number 1, it works with ligaments and muscles to move the upper and lower limbs. Now, all 3 work as levers to lift the weight and move faster. Number 2, it stores calcium, phosphorus, magnesium, and salt, all of which are needed for the body to work. 3, hematopoietic, meaning that it makes red blood cells, white blood cells, and platelets from the bone marrow. Next is miniature or short long bones. Why are they referred to as short long bones? The metacarpals of hand, metatarsals of foot, and phalanges in both the hand and foot are some examples. These are regarded to be long bones, but they are not true long bones. Since actual long bones always have 3 parts, an upper epiphysis, a lower epiphysis, and a middle shaft. Whereas, short long bones each have only 1 epiphysis, and a long tubular shaft, the diaphysis. The opposite end looks like an end, but it is the continuation of the shaft, also referred as pseudoepiphysis. Now, short bones. Always, the short bones, whose length and width are approximately same but with different shapes. Their main job is to give support and stability, while moving as little as possible. These bones only have a thin layer of compact bone on outside, with inner cancellous bone, with lot of bone marrow. It takes the shape of cube, trapezium, scaphoid, or boat shape. The examples are carpal or wrist bones, and tarsal or foot bones. What is flat bones? Flat bones are strong, thin plates, that protect essential organs, and support muscles. Cranium, scapula, sternum, ribs, and hip ilium are flat bones. The center is cancellous or spongy bone, with varied proportions of bone marrow, whereas the outside and inner parts are compact bone for protection. Flat bones create the most adult red blood cells. Now, what is irregular bones? Irregular bones are those in the body that do not fit into any other group because of their variable shape. Some examples of these are the vertebrae, sacrum, and mandible or lower jaw. They are mostly made up of cancellous bone in the middle, and with a thin layer of compact bone on the outside. What are pneumatic bones? These are special type of bones, found only in human skull bones, and many in bird skeleton. Pneumatic bones are characterized by the presence of an internal cavity that is filled with air. In the context of human anatomy, these bones forms, the paranasal air sinuses, are associated with the nasal cavity as they envelop it. Pneumatic bones includes the maxillary bone, frontal bone, sphenoid bone, and ethmoid bone. The atmospheric air can freely flow through these sinuses during respiration and cools the inspired air. It acts as a resonance of voice and reduces the weight of the skull. These images elucidate the anatomical arrangements of pneumatic bones. Specifically, the bones involved in the formation of the paranasal air sinuses. The final type of bone, from the classification, according to their position, is sesamoid bone. What are sesamoid bones? Sesamoid bones are a type of small, distorted bone that grows from a muscle tendon. There is no periosteum and these are not real bones. Their job is to change the amount of pressure, reduce friction, and sometimes change the direction of a muscle pull. The patella or kneecap, pisiform, one of the carpal bone, and two small bones present at the head of the first metatarsal in the foot, are the most obvious examples of this. Students, we have completed 2 bone classifications. 2 are still waiting. In the next discussion, third category of bone classification will be studied, focusing on their developmental or embryological characteristics. According to this classification, the bones are further classified into 1. Membranous, or dermal bone. 2. Cartilaginous bone, and 3 is membrano-cartilaginous bone. First, I will discuss about the membranous bone. Before, you people should know about the term ossification. Now, what is ossification? The bone formation, also called ossification. It is the process by which new bone is produced. Ossification begins about the 3rd month of the fetal life in humans, and is completed by late adolescence. Intramembranous bone, that ossifies directly in connective tissue membrane, without previous existence as cartilage, and they are also called as dermal or investing bones. During membranous ossification, the mesenchymal cells from neural crest, which are special type of ectodermal cells, that multiply and form the bony nodules, capillaries, osteoblasts, and bone precursor cells develop from these cells. The pre-bone osteoid or matrix calcifies, because osteoblasts release a proteoglycan collagenous matrix, that binds calcium salts. In addition, dense mesenchymal cells create the periosteum around all calcified bones. The inner periosteal cells also become osteoblasts, and deposit osteoid or matrix. Thus, multiple bone layers form. Examples for membranaceous bones are frontal, parietal, part of occipital and temporal bones, mandible, maxilla, and clavicle except its medial end. What is cartilaginous bone? During cartilaginous bone formation, hyaline cartilage model is changed into bone. It starts when mesenchymal cells change into chondrocytes, which are the cells that make cartilage. Then, osteoblasts make a thicker area of solid bone in the shaft or diaphysis, and the growth plates or epiphyseal plates of cartilaginous bones. Then, chondrocytes multiply quickly and release an osteoid, which helps cartilage that takes the shape of bone. Later, the changed matrix lets hardening happen. This cartilage template makes it possible for blood vessels to grow in. The blood vessels also bring in osteogenic cells, which change the perichondrium into the periosteum. At last, after birth, this process is repeated, creating the bone that will remain in the body forever. Any idea about membrano-cartilaginous bone? In human body, some bones are developed partly from membrane and partly by cartilage. Examples are mandible, clavicle, occipital bone, temporal bone, and sphenoid bone. Now coming to last classification, in this, the bones are classified according to their structure. They are classified further into 1. Compact bone, and 2. Spongy or woven bone. Let's find out more about compact and spongy bone. Compact, or cortical, or lamellar bone, is denser and stronger than the spongy type. It forms the long bones diaphysis, that is deep to periosteum. The microstructure of compact bone is called an osteon, or Haversian system. Osteon contains main lamellae, that are concentric rings of calcified matrix. Blood, nerve, and lymphatic vessels run through each osteon's central canal or Haversian canal. Now, each lamellar rings have lacuna with single, mature bone cells or osteocytes. Narrow, branching canaliculi link lacunae. These canaliculi hold nearby osteocytes protoplasmic processes that join, via gap junctions, so the central canal, allowing blood to exchange nutrients and waste. Now I'll talk about a spongy bone, which is the last type of bone in the structural classification. What is spongy bone? Spongy bone, also known as cancellous, or woven bone, exhibits a lower density and weight compared to compact bone. Spongy bone is composed of trabeculae, or bony bars, that are in close proximity to small, irregular cavities that housing the red bone marrow. The trabeculae within spongy bone exhibit a structural arrangement that is oriented along the lines of mechanical stress, allowing for potential realignment in response to alterations in stress direction. The canaliculi in spongy bone establish connections with neighboring cavities in order to receive their blood supply. There is no Haversian canal, like compact bone. Although the arrangement of trabeculae may initially seem random, it is actually structured in a manner that improves strength, similar to the careful positioning of braces in architectural support systems. Example, all the ends, or epiphysis of long bones, skull bones, ribs, hip bones and vertebrae. Dear medical students, today, I'll finish this general anatomical topic with bone. You get many written exam questions from this topic. Hope you enjoyed this session. I'll talk about cartilages in the upcoming video. Thanks for viewing.